Hi, I'm Annu Navani, Dr. Annu Navani. I'm the Medical Director of Comprehensive Spine and Sports Center. I formed it in 2008, and it is located in Silicon Valley in San Jose, California. I'm also an adjunct clinical associate professor at Stanford University and have held that affiliation since 2004. I enjoy practicing interventional pain and orthopedic medicine, and over the years have performed several interventional procedures of the spine and orthopedics. Our resources for doing these injections were limited to local anesthetic and steroids over the years, but I always wondered if there was a solution that would be natural, holistic, and long-lasting. And I had been following along resources for regenerative medicine for a number of years. It's been around decades over the world. In the United States, perhaps more popular over the last 20 or 30 years. And when I felt comfortable, I brought it to my practice about 6-7 years ago. I have been really amazed at the results, and patients love it because it's something that's very natural, it's organic, and it has potential of healing them for the rest of their lives. We have been using that for orthopedic and spine medicine cases. We have been using platelet-rich plasma as well as bone marrow-derived mesenchymal stem cells. These biologics we harness from the patient's body. Platelet-rich plasma is a collection of growth factors that's present in platelets, blood cells in our body, and it's harnessed through blood draw. The bone marrow-derived mesenchymal stem cells are harnessed through the iliac crest or different bones of human body, and they're injected into the joints or the musculoskeletal tears or ligaments and tendons, or even the discs and the spinal structures, with the potential of helping repair and restore the damaged body parts, and even in some cases regenerate tissues. There is a lot of science that is yet to come in this field. It's a new, rapidly growing field, and I'm here at ACEP talking about it. I have been involved in speaking at the meetings in this specialty for quite a few years. I have also given these lectures at Stanford, and I feel this field has great potential and something that can give us solutions that we've been looking for that are non-surgical, minimally invasive, and natural, and have a potential of healing people for the rest of their lives. So the physicians who are not very familiar with this technology or this field of medicine would be best served if they started reading some of the journal publications that have been around. Our group has been prolific in publishing whatever data we can collect from our patients. We have publications on lumbar discs, on sacroiliac joints, and the use of regenerative medicine techniques in those areas. We also recently published a paper on lumbar discs and novel therapies that can be employed with regenerative medicine protocols. We have also in that paper reflected on what we see as future of regenerative medicine and how we can make the field stronger. We have also written a couple of book chapters on this, as well as we are in the process of writing a book on regenerative medicine at this time. Those will all be great resources for people. In addition, I think coming to meetings, exchanging ideas with people, listening to the lectures would be great starting point for some people. There are also cadaver courses and workshops that are set up for training people from ground up, and that goes not only to educate them on the basic science aspect of it, but also clinical aspects of it as to how to perform the procedures and how to bring it from bench to bedside. There are several different kinds of stem cells that can be utilized in patients. They can be obtained from several different sources. There is something called autologous stem cell, and that stem cell from their own body. And then there is allogenic stem cells that's from someone else's body. The stem cells can be harnessed from multiple different structures of human body, multiple different bones, also from fat. Stem cells are present anywhere and everywhere in human body, and we all have stem cells in abundance. If we didn't have stem cells, we would die in an hour. In addition, there are stem cells that can be brought forth from amniotic membrane, from fetuses, umbilical cord, and there are multiple sources of stem cells. I think the steroids still have their role in that they decrease acute inflammation and acute pain. However, stem cells may offer therapies that may be long-lasting and that may help in repair and restoration, which steroids don't do at this time. I've had people that have been weekend warriors all the way through pro athletes that we've injected with this. We have had MMA fighters, UFC fighters who have had significant wrist injuries, so much so that they could not go play their, go and fight, or pro athletes who could not get back to their games. And when we have used these techniques, although it comes with a rest period and then engagement in physical rehabilitation to build up their endurance and strength to their final goal, it does take time to ramp up to that level, but they have gone back and performed much better. Even some of the pro athletes we all know of, such as Tiger Woods, Steph Curry, have received regenerative medicine treatments. So the regenerative medicine is currently considered to be experimental by insurance companies. It is not FDA approved technique, so the use is off-label. It is not covered by insurance companies currently in the United States. It is something that the patients pay out of their pocket. However, there are ways in which patients can engage in these treatments as a part of a study, which can be funded, in which case it's free for the patients. All I'd like to say is this is a field of great promise. This may be the field that we've been looking for, the solution we've been looking for our patients that's natural, holistic, and may have a potential of helping them for the rest of their lives by repairing and restoring their injuries, and in some cases even regenerating. I think we need to work together as a team to build the data that we need to be able to bring it on as an evidence-based treatment to our patients.